The next one is mesothelioma. Theloma is a type of cancer that affects the mesothelial cells, which line the outer surface of the body's organs, including the lungs, abdomen, and heart. The most common form of mesothelioma is pleural mesothelioma, which affects the lining of the lungs. This type of cancer is often caused by exposure to asbestos fibers, which can become embedded in the lungs and cause inflammation and scarring over time. The next is despite advances in mesothelioma research and treatment, the prognosis for patients with this disease remains poor. The 5-year survival rate for mesothelioma patients is less than 10%, and the average life expectancy after diagnosis is only 12 to 21 months. However, there are several treatment options available that can improve prognosis and quality of life, including surgery, chemotherapy, radiation therapy, immunotherapy, and clinical trials. For mesothelioma, surgery is often the first line treatment of mesothelioma, as it can potentially remove the cancerous tissue and improve prognosis. There are several types of surgery available for mesothelioma, including in which P over D. This involves removing the lining of the lung and any visible tumors. The next one is EPP. This involves removing the lining of the lung itself, and any surrounding tissues that may certain cancer cells. Next one is about to HIPEC. This involves removing visible tumors and then applying a chemotherapy directly to the affected area. Chemotherapy for chemotherapy involves using drugs to kill cancer cells. It is often used in combination with surgery or radiation therapy to destroy any remaining cancer cells. There are several chemotherapy drugs need to treat mesothelioma, including cisplatin, carboplatin, Alimta. Alimta this is a newer chemotherapy drug that targets mesothelioma cells specifically. The next is cisplatin. This is platinum based chemotherapy drug that is commonly used in mesothelioma treatment. Next one is carboplatin. This is another platinum based chemotherapy drug that is less toxic than cisplatin. Radiation therapy for mesothelioma. Radiation therapy involves using high energy X-rays, in which there are two types of radiation therapy: external beam radiation therapy and brachytherapy. After that, immunotherapy for mesothelioma, in which checkpoints, vaccines, clinical trials of mesothelioma. Next, we have to discuss about clinical trials of mesothelioma. Clinical trial involve testing new treatments of medications to determine their safety and effective. Participating in a clinical trial can give mesothelioma patients access to new and innovative treatments that are not yet available to the general public. Clinical trials for mesothelioma may involve new chemotherapy drugs, immunotherapy treatments, or targeted therapies. The next one is gene therapy. This involves using genetically modified viruses to target and destroy cancer cells specifically. Heat therapy. This involves heating the affected area to destroy cancer cells and improve the effectiveness of chemotherapy. The next one, combination therapies. Combining several different types of mesothelioma treatments has shown promise in improving survival rates and reducing side effects. The last is about conclusion. Mesothelioma is a rare and aggressive cancer that requires a multidisciplinary approach to treatment. Surgery, chemotherapy, radiation therapy, immunotherapy, and clinical trials are all treatment options available for mesothelioma. With the latest advancement in mesothelioma research, there is hope that new and innovative treatments will emerge that can improve prognosis and quality of life of our mesothelioma patients.